Okay. The title of this presentation is Why Are We Here? We're focusing around the coronavirus. We want to look at why is it that Black people are suffering disproportionately from the virus, and what can we do to change the paradigm? What can we do to change this scenario? First, let's look at the problems. Uncovering the problems of racial disparities in COVID-19. This chart from the CDC gives us more indication of the disproportionate effect the coronavirus is having on African American people. You see here that in areas where they have COVID-19, Black people were suffering from 33% when they're only 18% of the population. So we're really hitting this hard. It's about we're about 2 times as affected by other people. Some more information on why. How.
Look closely at this face. It's the face of one of COVID-19's victims. It's a window into the story of who coronavirus is killing. Black people are dying at disproportionate rates in the United States.
I will miss my daughter for eternity. She was like a butterfly. She was just a great daughter.
Experts say the U.S. could have anticipated the deadly disparity.
Because we know that anytime a new disease enters the community, people of color tend to get the downside of that, and that's just not surprising at all. That was a recipe for disaster.
And some believe the solution to closing the gap isn't a return to normal, because normality is what produced the circumstances that left Black people more vulnerable.
I don't want to get past this pandemic, because the reality is that where we were wasn't really working for us.
Hey fam, I'm Emayan, and like some of you, I'm working from home during this pandemic. And today we're gonna look at the social and economic factors that led to this acute crisis. It's a story about so much more than underlying health conditions.
Her last paycheck was $20.63. The $20.63 is what cost her, is what took her life away. But I do know that she died helping humanity.
When grocery store worker Leilani Jordan finally made it to the hospital with severe coronavirus symptoms, her mother, Zenobia Shepherd, says she was already fighting for her life.
When she got to the emergency room, she fell out in the parking lot of Walter Reed, and they put her on a gurney and took her in. And immediately she had 104 fever, and they put her in isolation.
27-year-old Leilani entered the hospital on March 27th. She died April 1st, and even in her final moments, Zenobia says she had to push the chaplain to spend time with her daughter.
And I held her hands, and I sang to her, and I sang to her, and I sang to her. I touched her feet. I touched her hands. I touched her arms. I got in her ear, and I said, "Lonnie, it's Mommy. I'm right here." Then she coded.
Leilani is one of the many Black Americans on whom the virus has exacted a particularly deadly toll. Around the U.S., early data shows Black people who contract the virus are dying more frequently than others.
The governor of Louisiana says more than 70% of their deaths have been African Americans.
Look at this chart. You can see African Americans represent 41% of COVID-19 deaths. The next closest race, Caucasian at 28%.
In Chicago, nearly 70% of virus-related fatalities are Black, even though African Americans make up less than a third of the population.
The numbers we're seeing aren't because Black people are getting infected more often. They're not, according to Dr. Anthony Fauci. There's something much deeper going on here.
Sometimes when you're in the middle of a crisis, like we are now with the coronavirus, it really does have ultimately shine a very bright light on some of the real weaknesses and foibles in our society.
The United States' long-standing racial health gap, which is fueled by inequality, is more than a foible. Let me show you.
Even though Black Americans are living longer than they have in the past, they are still more likely to die at early ages from all causes.
You know, we know that there are reasons why we have these health inequities, and that's our societal issues, you know, transportation and housing, and the environment, and all the things that we know that people of color have to deal with that are unequal. And by the way, that includes discrimination and racism.
Black people between 18 and 49 are twice as likely to die from heart disease than white people. And Black people from ages 35 to 64 are 50% more likely to have high blood pressure than their white counterparts. And then there's the fact young African Americans are living with diseases more common at older ages, things like stroke, diabetes, and high blood pressure.
For some of us, 45 is in their 60s.
There are some familiar explanations for what's happening. Higher rates of diabetes.
African Americans have higher risk for a lot of these conditions across the board.
The hypertension, the obesity, the asthma, those are the kind of things that wind them up in the ICU and ultimately give them a higher death rate.
It's easy for people to understand talking about diabetes and heart disease, et cetera. And there's always this undercurrent that it's somehow your fault that you have that. Yes, having disproportional health outcomes is important. It's not necessarily anybody's fault. The other thing we have to do is recognize that a lot of people of color work in public-facing jobs. That means while folks like me are able to stay at home, there are many people that can't.
When we filter the entire U.S. workforce by race, we find Black workers account for 13% of the labor force. It's comparable to their numbers in the nation's general population. And when we drill down to see what kinds of jobs people have, we learn people of color are more likely to be in roles deemed essential in this pandemic. Roles like the one Leilani Jordan had. Black and Hispanic workers are at the top of the list for work the government calls production, as well as the service industry, transportation, and material moving. These generally lower paid jobs likely don't have paid sick leave, health insurance, or retirement benefits. Black people also have higher unemployment numbers than any other group.
What I didn't include in those stats was the racial gap in median salary. You know, because the amount of money you make and have has a direct correlation to the type of healthcare you can receive. So this is why focusing solely on underlying health conditions to explain away why Black people are dying disproportionately of COVID-19 isn't enough. These fatalities are the result of larger systematic issues.
Some more information about the problem that we're facing with this COVID-19. We keep emphasizing that we're soon to be twice as likely to suffer from this disease as anybody else. And that's important because we'll come back and discuss that later.
The increased number of comorbid conditions that we experience, like high blood pressure, diabetes, being obese and overweight, these are all, you know, starting to become more clearly delineated risk factors as more and more people get impacted by this infection and as we learn more. And then we have all of the other same issues that everybody else in the world has. So cancer diagnoses, autoimmune diseases, asthma. Asthma is actually increased in prevalence in city communities and more densely populated communities. Our children and our adults tend to have more frequent diagnoses of asthma and tend to do worse with these types of conditions. And then other things that we might do habitually. So are you a smoker? Are you a drinker? And then our communities tend to not have immediate access to healthcare. And then on top of that, sometimes we're dealing with healthcare disparities. So are we being taken seriously when we present for medical attention? CDC is always putting out information. The World Health Organization is putting out daily updates. You can tune into these very readily on their social media platforms. They have done a great job of communicating the information that we need to know in lay terms that people can understand. And they're giving a global report. And then you can tune into your city and state, either local health departments or governing bodies who are giving updates online as well. We have to tackle this thing from every point that we can possibly tackle it so that we diminish the spread in our community so that we can flatten the curve. It's not going to go away quickly, but we all must do our part and really take this thing seriously if we're going to get ahead of it.
If you're still trying to figure out how to start an online business or how to get people to actually buy from you,
what can we do to solve this problem? What are some of the things we can implement in our own lives that can help us deal with the issues that we're facing, individually and collectively? I want to re-emphasize a couple of things that were said in the two previous videos. First of all, Dr. Gaffney said we must all do our part, which means we have to do what we can to address our own situation so we can be better prepared for this disease now and in the future. And David John said where we were really wasn't working for us, meaning that we don't need to go back to the way things were. Everybody's trying to rush back to normalcy. Everyone wants to go to the beach, everybody wants to go out, have fun, go to the movies, etc. But collectively, from the situation that we're talking about here, the situation we're in as Black people is not going to improve from the disease. It's only going to get worse unless we do something to make it better. And what's the government say we could do? Well, you've all heard the stories. You should protect yourself and others in the community. Don't wear a mask. Don't be 6 feet from people. Don't hang out with other folks. Cope with stress. But what does any of this mean? Nothing in here tells us anything that we can do to support our own immune system and make us physically stronger to fight the virus. Now, we heard in the previous videos that we're about twice as likely to suffer from the disease or die from the disease than other people. Well, it's also true that African Americans are about twice as likely to be vitamin D deficient than other Americans, which in the vitamin D deficiency is directly linked to a number of underlying conditions such as stroke, type 2 diabetes, heart disease, hypertension, etc. Not only that, in Britain, they've been doing autopsies on people, and they found out that the majority of people who are dying are people who have higher deficiencies of vitamin D. And people who have dark pigmentation reduces the vitamin D synthesis. So we're directly at link, in the risk factor for suffering from the disease based on not having enough vitamin D in our system. The educators and clinicians have known since 2006, when the study was done, that African Americans need to take more vitamin D. But no one's telling the people this. What else can we do? They talked about a number of risk factors: hypertension, heart disease, diabetes, etc. And we know from the studies that all these are factors linked to diet. So there's this book published on NIH's website, which compiles a lot of research in the studies that have been done, clinical studies that have been done on diet-related factors to indicate and show that a vegan diet is healthier, might be healthier than other diets. In all, vegan diets are adequate for all humans, and all causes of mortality were 9% lower amongst vegetarians. Obesity, one of the risk factors for this disease. A vegan diet reduces obesity. Cardiovascular disease. A number of studies have been done to show that vegetarians and vegans have lower mortality rate from cardiovascular disease because of the diet. 29% in one study, 24% in another study, 32% in another study, and death for vegans was all about half of that for non-vegans. Hypertension, lowest amongst vegans. Type 2 diabetes. Vegan diets are very helpful in prevention and treatment of type 2 diabetes, which is another risk factor. Cancer, less likely to cause cancer, a vegan diet is. They talked about asthma and children breathing and stuff, etc. We all know that milk is also linked to these problems. And cow's milk, which is low in iron, causes intestinal bleeding, and it interferes with the absorption of iron and zinc in the body. Iron and zinc, primarily zinc, is very important in terms of fighting viruses, because zinc is an antiviral mineral. What are some other things that the vegan diet can help us with in terms of future pandemics? Some 3 in 4 new and emerging infectious diseases come from animals, like SARS, bird flu, swine flu, Ebola, and AIDS. Coronavirus originated in animals. This other stat is pretty phenomenal. 56 zoonotic diseases, 2.5 billion cases of human illness a year, and 2.7 million deaths per year from diseases caused by man's eating and hanging out with animals. Now, this 2.5 billion cases of human illness is significant because the world's population is only about 7.5 billion. So that means that 1/3 of all people on Earth every year get sick from diseases related to eating and hanging out with animals, factory farming, wildlife trade, etc.
I'm sorry, there was a temporary signal loss there. What I was saying is that there are multiple things that begin to happen, okay? And when those things begin to happen, at the end of the day, what happens is that blood clots, that's emboli, and then there is mucus formation, allergic reaction, hyperinflammation, bleeding, and all of these things will lead to what we call hypoxia, low oxygen level, and the person suffocates, and then the person dies. This is how the thing works. Now, so COVID-19 kills through all these multiple actions in the body. That's how it kills all those things. Okay, now let me talk about the issue of vaccines, because people have been touting that, oh, they need to develop vaccines to address this particular situation, and vaccines are important. If there are no vaccines, we're going to be helpless. The lockdown cannot be lifted. We cannot go back to economic activities. Well, personally, I don't believe in that sentiment. Vaccines have their place, but I have 2 major reasons why I personally don't think vaccine is the answer to COVID-19. Vaccine can be one of the options, quite all right. I'm not disputing that. It can be one of the options, but it is not the only option. That's number one. And number 2, it is not even the most effective option. Why do I say so? First, all the viral infections that the world has ever experienced, how many of them have vaccines that is able to protect people sufficiently? Not one. People who get flu shots, we still have to keep getting it every year. This particular COVID-19 virus mutates very quickly. So even if you take a vaccine that is effective, tested and effective today, in 3 months' time, 6 months' time, another variant has come out and another vaccine will be needed for that particular one. That's number 1. Number 2 reason why I think vaccines should not be the primary focus is that the current vaccine that they are trying to develop for this particular COVID-19 infection is not the typical vaccines that we are used to. The typical vaccines that we are used to, okay, they take a virus and weaken that virus, pump it into a person's body to stimulate an immune reaction so that the body develops antibodies against that weakened virus. So next time that person gets exposed to the real virus, the body already knows how to fight it. That is the principle of vaccination. But this particular vaccine that they are trying to develop is not that type of vaccine that we are used to. None like it has ever been developed in the whole world and used in humans. None. This is the first time they are trying to develop this type of vaccine. It is called the mRNA/DNA nucleic vaccine. That is the vaccine that they are developing now. mRNA/DNA nucleic vaccine. And that particular vaccine, this is what is happening. Okay, it has never been approved for human use as a new vaccine. Now, what they do is they take the genetic material of the virus, not a weakened virus now. They take the genes of the COVID-19 virus and inject it into the human body to fuse with your human gene. So that is, in my view, scientifically speaking, that is genetic modification. They are trying to create human GMOs, genetically modified organisms. This new type of vaccine, it has never been approved for human use. There was a trial that was done in veterinary animals, you know, to see how it works, and it was a disaster, and so it was banned. Now it is the same vaccine that is untested, that is about to be administered, and the worrisome part of it is that they are also striving to make it mandatory for everybody. If you don't get that vaccine, you can't get to certain places, you can't do certain things, you can't travel to certain places, you may not be able to get visas to certain countries, and all of those things. Now, the mandatoriness of that vaccination is a violation of our human rights. That is why I personally think it is not something we should explore. So, we must begin to look in other directions. Vaccines serve as one option, but there are other natural substances that equally can serve to help. So in rounding up, let me just give you a few natural substances that we can use to help us, you know, in addressing this issue, both to strengthen our immunity and to protect us in case we also contract it, how to win that battle. The first one I will give as a natural suggestion is limit your going out to only places that are absolutely necessary. Like I said, you don't want to unnecessarily and unduly expose yourself to, you know, unnecessary battles. So if you must not go to a place, if it's not compulsory, don't go there. Go to only places that is compulsory or mandatory for you to go. That's the first common sense thing I would say. Number two, you need to have certain things in your first aid box. Number one, you need to have zinc in your first aid box. Zinc is so critical, so wonderful, so powerful that, in fact, when zinc enters into your cells, it can stop COVID-19 from replicating. Now, I am not prescribing for you because I'm not your doctor, but I am a nutritional consultant and I'm offering my wisdom. That's all. You have the human right to prescribe for yourself in case you want to use these items. And they are OTC, by the way, over the counter. You don't need prescriptions for them. You can walk into any health store or even online and place an order. If you take about 50 milligrams of zinc every day, it is a mineral. It is not a drug. It is not a pharmaceutical drug. So you don't need a prescription for it. You can prescribe for yourself. It's your constitutional right. It is your human right. Zinc, very powerful. When zinc is used in combination with a transporter, it works even better. A transporter is something that allows zinc to go into your cell very well. It opens your cell membranes and allows zinc to go in. And that is the job that hydroxychloroquine actually does. Hydroxychloroquine helps to open up your cell membranes to allow zinc to penetrate the cells. And there are certain foods we eat that are high in zinc, something like ginger, for example. You know, I've seen several people who have beaten COVID-19 and they said they blended ginger with garlic, with lemon, with turmeric, with this and that, and they boiled it and drank it. Now, one of the things I have observed is that some of those substances they boil together actually are rich in zinc, particularly ginger, very rich in zinc. And the zinc in there can help to stop the replication of the virus, and it also boosts your immune system on the other hand. So it is weakening the enemy and it is strengthening your immune system so that the odds are now against the virus at the end of the day. So when people when they take a hydroxychloroquine, of course that one requires a prescription from a licensed medical person. Now that one is going to help to open the cell membrane, and then zinc can go in and strengthen your immunity while stopping the virus from replicating. That's how the combination works. So the first thing you need in your medicine chest or first aid box as a natural element to put you in good stead is zinc. And also eat zinc-rich foods. You can go online and Google foods that are rich in zinc, and you see a catalog of all the foods that are rich in zinc, and they will help you a lot. The second thing you need is vitamin C. Vitamin C is an antiviral vitamin. Very, very potent against all manner of viruses. You know, the flu virus and all the other viruses. If anybody comes down with a flu, one of the things that your doctor will give you is vitamin C. Again, vitamin C is an OTC, over-the-counter medication that does not require prescription. So take a lot of vitamin C, okay? For those who have caught the infection, they can actually take like 1,000 to 2,000 milligrams every 4 hours, 8 a.m. in the morning, 12 noon in the afternoon, 4 p.m. in the evening, and then 8 p.m. in the evening, and that will keep them going. For those who are familiar with lipospheric vitamin C or liposomal vitamin C, that one even works better because of improved bioavailability. And if you can't get liposomal vitamin C, any type of vitamin C will do. You can also eat foods that are rich in vitamin C. The citruses, see the lime, the lemon, the orange, the tangerine, all of them are rich in vitamin C. That's why when people blend the lemon juice, the lime juice with ginger, with garlic, it works fine because of the high content of zinc in ginger and the high content of vitamin C in the lemon, the lime. Okay, then another thing is things that serve as blood thinners. I mentioned the way COVID-19 kills those that it kills. Number one, it causes an allergic reaction, so excessive mucus production that affects respiration. Number two, it causes hyperinflammation, so you need to take anti-inflammatory agents. Those anti-inflammatory agents, they are simple around. Turmeric is an anti-inflammatory agent, turmeric. You can make it into turmeric tea, you can blend it into your smoothie, you can put it into your cooking, and then omega-3 oil is also an anti-inflammatory agent. Fish oil, flaxseed oil, okay, cod liver oil, all of those are anti-inflammatory agents. They can reduce inflammation. And then you also need anticoagulants or blood thinners that will not allow those emboli or those blood clots to take place when they're infected with the COVID-19 virus, okay? And ginger is very good garlic is a good blood thinner, garlic. Cinnamon is another blood thinner. So when you see a combination of ginger with zinc, garlic as a blood thinner, turmeric as an anti-inflammatory agent, and lemon, lime as a source of vitamin C, the combination is potent. And it blocks all the different pathways by which the virus provokes the body to start attacking itself. And once one can sustain that battle, by blocking those pathways for upwards of 14 days, by the grace of God, that person comes out of that situation. So you need zinc, you need vitamin C, you need anti-inflammatory agents like turmeric and omega-3 oil, and you need anticoagulants or blood thinners like garlic, like cinnamon, like cayenne pepper. All of these things are very good as blood thinners, okay? And then something very hot all the time. Don't take cold beverages and cold drinks if you are exposed to the virus. Of course, the wisest thing to do is to prevent exposure by all means. That in case you are exposed, you can do these things at the natural level. Then at the spiritual.
Okay, now the brother mentioned several things that are very important in terms of things that we can do for ourselves to help deal with this virus. Now, the Orthomolecular Physicians Society put out a similar recommendation where they recommend that people take 3,000 milligrams of vitamin C per day or more, 2,000 international units of vitamin D3, magnesium, zinc, selenium, all of which have been shown to strengthen the immune system against viruses. There are things that we can do, need to do, should do, have to do if we're going to improve our situation relative to this virus. And here, the author of Molecular Doctors also report that in China, they're doing a clinical study with vitamin C on COVID-19 and other respiratory issues. So the question is, are we really truly ready to do our part? And what does our part look like? We can't go back to normal. We can't go back to the way things were, because where we were really wasn't working for us. So what were the kind of things that we as a people were doing too much of? Drinking alcohol, which adversely affects your vitality, your immune system. Smoking, all kinds of things. Anytime you take smoke into your lungs, you're impairing the lungs' functionality. So no matter what you're smoking, you're creating a problem for your lungs, and the lungs are what's most attacked by this virus. Eating all kinds of things. We already saw the studies that show that if we change our diets to vegan diets, we will ameliorate many of the problems that we're having individually and collectively in terms of health factors relative to the virus, as well as we'll also protect ourselves from future viruses because we're, again, getting rid of interaction with these animals, which is a source of many viruses. So if we do the things that we're talking about doing here and the things that we're going to learn during the course of this conference, we can add some real substance to the government's recommendations. It's also enable us to strengthen our immune system with the various herbs, supplements, remedies, and meditations presented to not just cope with stress, but to transcend it. Thank you for your support, and together we will be victorious. Etepu.